Today we're going to talk about the Concussion Management Medical Team. The Iowa Concussion Consortium is an organization that come together to support Iowa's youth to coordinate and distribute consistent and reliable guidance to concussion and other brain injury. Concussion management protocols such as REAP are a multidisciplinary protocol to follow after a student or athlete has sustained a concussion. REAP stands for Remove and Reduce, Educate, Adjust and Accommodate, and PACE. The multidisciplinary team includes team members who provide multiple perspectives of the student and athlete, and team members who provide multiple sources of data. Every member of the multidisciplinary team is important. The multidisciplinary team includes team members who provide multiple perspectives of the student and athlete, and team members who provide multiple sources of data. First, we have the school team in physical education and/or the family team, which are the parents. They have a critical role in the beginning of the concussion, as they may be the first ones to recognize and identify the concussion and remove the student athlete from play. Second, we have the medical team that has an essential role in diagnosing the concussion and ruling out a more serious medical condition. Third, for the next 1 to 3 weeks, the family team and the school team or academic providers will provide the majority of the management by reducing social, home, and school stimulation. Fourth, when all 4 teams decide that the student athlete is 100% back to pre-concussion functioning, the medical team can provide the graduate return to play steps. Finally, when the student athlete successfully completes the return to play steps, the medical team can determine final clearance. The medical team consists of the emergency department, primary care providers, nurses, concussion specialists, neurologists, clinical neuropsychologists, and others. Every member of the team is important and is essential part to play as certain stages of the recovery stage. First, the school team and physical team and/or the family team recognize and identify the concussion and remove the student athlete. Second, the medical team has the essential role in diagnosing the concussion and ruling out the more serious condition. Third, for the next 1 to 3 weeks, family team will provide the majority of the management by reducing the school and home stimulation. And fourth, when all 4 teams decide that the student athlete is 100% back to pre-concussion functioning, the medical team approves the return to play steps. The time frame of the medical team, the first steps is to assess and diagnose the concussion, assess for head injury complications, which may require additional evaluation and management. It could recommend return to school with academic adjustments once symptoms are improving and are tolerable, typically within 48 to 72 hours. Medical team will educate the student athlete and family on the typical course of concussion and the need for rest. They'll also monitor that symptoms are improving throughout week 1, not worsening in the first 48 to 72 hours. The second steps will be to continue to consult with school and home teams, follow-up medical checks, including comprehensive history, neurological exam, detailed assessment of mental status, cognitive function, gait, and balance. The third steps of the time frame would be to continue to consult with the school and home teams. Weeks 3+, consider referral to a specialty concussion clinic if their student is still symptomatic. It is best practice that a medical professional be involved in the management of each and every concussion, not just those covered by legislation. When you diagnose concussion, recommend multidisciplinary team approach. The medical team is to remove the student athlete from all physical activity immediately, rule out more serious medical issues, including severe traumatic brain injury, support reduction of school demands and home social stimulation, and encouraging rest. This is our graduated return to play chart. You can see where it says no activity. The symptoms are limited physical and cognitive rest. Once they're 100% symptom-free for 24 hours, then you proceed to stage 2. After stage 2, if the symptoms reemerge with a level of insertion, then you return to the previous stage, and so on and so forth. Encourage the student athlete to use the teacher feedback form while at school to be able to assess the symptoms for that team. Here are the partners of the Iowa Concussion Consortium. And here are some additional resources. To find the full copy of the Concussion Management Manual, please reference this link below. And for further questions, please contact the Brain Injury Alliance of Iowa at viaia.org.